Hi, welcome back to Therapy Unboxed with Lana Seiler. And today I have with me Dr. Hemphill, who is our Chief Clinical Officer at All Points North Lodge. Welcome.
Thank you. Glad to be here.
I'm excited about this episode. We are unboxing sex therapy today. Dr. Hemphill has a pretty extensive history working in sex therapy, both as a clinician treating sex therapy and also as a teacher teaching other clinicians about sex therapy. And we were just talking before the show. I really am excited to do this one because this is one of those topics that can be tough for people. I think there can be barriers for people to explore getting help in the area of sex, sexuality, sexual function. And I'm a big believer in let's get it out there and talk about it. And then maybe if people are a little more informed and it becomes more normalized, it might be easier for people to seek help in this area.
Yeah, that's a great point. A lot of people have grown up in their lives thinking that we just have to have the big talk, we have to break the ice. But life is really about using teachable moments. So as people evolve in their development and they pass things on to different generations, or they just have different experiences through entertainment or music or just life experiences, it's a great opportunity to have that conversation.
Yeah. And we can talk about this later, but there's so much, I feel like there's so much wrapped up in sex.
Sure.
For us culturally, in our family systems.
Sure.
So there's a lot to get into. I usually do just a brief sort of history, and I want to turn that over to you since you're the expert. Kind of and I know there's a difference between sex therapy and sexuality, and there's the Kinsey study on sexuality, but what about sex therapy? What's the history on that?
So it all started, really, it goes back to Aristotle, believe it or not, in that he initially was studying the reproduction of animals, and just there were all these myths related to sexuality and reproduction, and so he actually did some of the first scientific studies of sex, and you're talking like 400 BC.
Wow.
We don't like to really think, we think this is a new industry, this is a new field, but people have been inquisitive for centuries. And another shocking thing that we don't really think of is there were a number of females that actually studied sexuality in the 1800s.
Wow.
Yeah. As a matter of fact, the term sexology was coined by Dr. Willard, a female. Very, very interesting. We have these misconceptions, especially in the United States, that it's a very short history. But in fact, the study of human sexuality really is very deep and is international and across the world. The problem is linking people together and communicating about these things.
Mm-hmm.
That has not always been the strong point for sexuality, because it's not really on the forefront of science. It's very challenging to have resources dedicated to human sexuality and understanding and just unpacking the whole concepts of sexual expression. Most societies sort of shy away from that. It's just it's just a natural process. It's a natural function.
Yeah.
And we found that that's not accurate. But if you look at the actual sex therapy, now that is a lot younger. So, you mentioned Kinsey.
Mm-hmm.
And, so Kinsey was he's an entomologist, which means this is a person that has studied bugs, okay?
Mm-hmm.
And Dr. Kinsey and his group were really about coding and categorizing what people did sexually. So they essentially would have a conversation like we're having, and they would just ask questions that were very structured, and then they would count them. But they never really really measured the actual physiology of sex. And where that eventually came from was from Dr. Bill Masters and Virginia Johnson. And this was in the 1950s. So they brought the sexual functioning into the laboratory. And they started treating it more like research and not doing just single studies, single person, single subject studies, looking at a group of people and how their bodies reacted. And, back in the 50s, we're looking very dichotomously at males and females. And so they actually measured the physiology that took place in sexual arousal and orgasm, and then the refractory period, which occurs after orgasm. And, later on, there was inclusion of desire. Yeah, we needed to add the concept that people actually were desirous. And today that's really been flushed out. But the original sex therapy actually, started with Bill Masters and Virginia Johnson. And they wrote a book, and their first book was Human Sexual Response in 1966. And then they wrote Human Sexual Inadequacy. So they followed up with an actual sex therapy book. Now, the interesting thing about them is that Dr. Masters was an OBGYN. He was not a psychiatrist. He didn't know that much about therapy, psychotherapy.
Yeah.
So he put in a lot of behavioral types of techniques to sort of, psychoeducation, some relational issues, but mainly just behavioral techniques. And so, with a traditional male-female couple, which had to be back in the 50s, that's how they were able to push that agenda forward with the very beginnings of sex therapy as we know it today. And so much so that you look at their findings, which were really in the 50s, but they published them in 1966. They're still in our DSM-5 today.
Wow.
We have, hypoactive desire. We have arousal, inadequate arousal. We have the inability to have orgasm. Those are the principles that were founded by Dr. Masters and Virginia Johnson.
I have so many questions. I'm trying to narrow them down in my head. I'm one of the things I'm wondering is just sort of culturally, and I know you're saying this is kind of across culture and across the world, that we don't really bring this into the petri dish or whatever very often.
Sure.
And I'm wondering if this, there's probably so much to do with that, right? There's this idea that it's just natural, everybody should know how to do it. B, there may be some hangups, right? A lot of times there's shame associated with talking about sexual, or embarrassment, talking about sexual things with people that you're not intimate with.
Yeah.
Right. And I'm just thinking that those might be some of the factors that have kind of stood in the way, maybe historically, of doing more of this type of research and work, but also B, people picking up the phone to call a therapist and say, I have this problem. Can we work on it together? Yeah,
absolutely. An interesting book that's a wonderful read is a woman named Mary Roach. She wrote a book called Bonk, B-O-N-K. She was a prolific writer, and she did sort of this sort of participatory journalism, where she went across the world looking at the foremost researchers in sex therapy and understanding human sexuality. And it was published maybe 10 years ago, but it's still relevant, I think, to your question and your comments, that there are certain societies, there are certain cultures who are a lot less comfortable understanding, bringing this forward, especially reaching out for help.
Yeah.
It's tough enough to just talk about the functioning, but if there's a problem, there's huge barriers. And so you're right. Sexuality, especially sex therapy, these are somewhat of political concepts and really based in culture, and there's always a genetic and biological component, but the social constructs are much more powerful. Yeah,
it seems that way. So what is sex therapy?
Yeah, that's a great question, because it's not the same thing to everybody. So sex therapy comes in many shapes and forms. Some people believe it to be relational therapy because they feel like you have to be in the context of a relationship to be sexual. Other people don't think that way. They think that, sexuality can be something I'm experiencing on my own and in a way that is pleasurable or unsatisfactory for me.
Mm-hmm.
There's sexuality that takes place in our minds through our fantasies. So, where exactly are the boundaries for sex therapy?
Mm-hmm.
What does that mean? Does it mean if I ask you what we call gravida apara? So gravida is how many times have you been pregnant? How many births have you had? Some may say that's sex therapy. You're asking these reproductive questions. So, if that's the case, then, most histories and physicals are going to be part of a sex therapy.
Mm-hmm.
Some people say that if you're talking to people about sexually transmitted infections, that's a form of sex therapy. So part of it comes from how one sort of sees their role in interacting with people related to their sexual expressions. When you think of the pure sense of sex therapy, essentially someone is experiencing distress.
Mm-hmm.
And one of those areas that I've sort of mentioned to you related to the physiology of the expression of sexuality, or it could be the psychological barriers related to feeling satisfied. The reason this is important is because we know that sexual satisfaction equates physiological satisfaction. People feel better about themselves through sexual expression and feel a sense of body image is better. There's studies that show us the increase in spiritual functioning and spiritual health by having a better sex life and being more sexual. So it just understanding the positivity that sexuality can bring. Relationships, just all of this plays into, what is sex therapy. In its purest sense, it's trying to understand the barriers that a person experiences, how they're defining sexuality, and what are some potential ways to alleviate that. So to give you an example, there's a model that a researcher named Annon, A-N-N-O-N, came up with. It's called the PLISSIT model, P-L-I-S-S-I-T. So the P stands for permission giving. So sometimes people come in, you listen to their story, and they just need permission. They just need an authority figure, somebody who's in a position to understand what they're experiencing, to give them permission, the P. The LI is the next one. Some people come in and they have limited information. So we become a conduit for providing really good, accurate information for people. So that's limited information. Some people need SS, which is specific suggestions. So this might be talking to people about masturbatory activities. This might be talking to people about how to stimulate their partner, how to stimulate themselves, giving them some guidance on writing out a sexual fantasy. So that's the specific suggestion. And then some people may need what we call IT, which is intensive therapy. So PLISSIT, permission giving, limited information, specific suggestions, intensive therapy. That's just the basic format that you can take to understand what sex therapy can be for people. Today we have this incredible push in sex therapy for medication management. That's really our first line of intervention a lot of times and our first line of understanding. So in doing an assessment of a person, you often, assessing the physiology and the medical barriers related to sexuality.
Yeah.
From there, the first intervention could be some type of medication management. And then you get more into the therapeutic, the psychological, and then you may move into, if it's a partner situation, the relational issues.
When we say medication management, are we looking at both what medications is a person on and how are those medications potentially affect them sexually, and medications that might help?
Exactly.
Yes, okay.
Absolutely. So both of those are prevalent.
Okay.
Both of those are important. Some people don't really understand that certain medications have side effects. And some people, just that our typical SSRIs, which are one of the most common, psychotropic medications prescribed. Well, most people don't understand that pretty much all but Wellbutrin are ones that have a negative impact on sexual functioning.
Yeah. Yeah.
So even something as simple as this. But yes, there are other medications that are out there. We know about Sildenafil and Viagra and these things for males. And then there are some more recent that have come out related to female arousal and female excitement and sort of the increase in blood flow, which has the increased potential for orgasmic experience.
Yeah.
So it's both removing the barriers for side effects, and then some additive medications.
And how did you decide that this is something you wanted to be involved in? How did you get into sex therapy?
Yeah, I get that question a lot. And part of that question is really based on the whole history of sexuality. There's definitely, like you said earlier, a stigma. So even clinicians sometimes will shy away from wanting to study this or wanting to research this because the burden of the stigma. And I can remember Dr. Masters. By the way, I've worked with Dr. Masters. He was on the early part of my career, my colleague, who really started a program for sexual trauma. He had worked at the Masters and Johnson Institute. He was their educator. He did psychological education for people that came through the system. He had trained at Johns Hopkins and actually did work with John Money, controversial John Money, and with Rhesus monkeys and all of this stuff. So he, in starting these programs for sexual trauma, we realized very quickly that there were so many other facets to sexuality that we had to work with, dealing with people with compulsive sexual behavior, and then, naturally dealing with people with sexual dysfunctions. At the time, we call them sexual dysfunctions. Today, we call them sexual disorders. But this, requires a lot of training in all of those three different areas. So how I got involved is as a newly minted clinician, straight out of school, I actually, applied for this job. And this incredibly avant-garde group of clinicians, selected me and brought me into their fold. And so, of course, I was, we had a handful of us that were newbies, and they had a number of them that were very seasoned. And it was just amazing. And the thing that was so attractive to me about this field was that the results, the incredible results in a very short period of time. And it just was something that was very rewarding. So through that early exposure in this area, it wasn't necessarily something that I said I wanted to study. I mean, I took human sexuality in undergraduate and graduate school, and I took sex therapy courses in graduate school, but never really like this was going to be my practice. But having that opportunity in a professional setting and being exposed to really the pioneers in the industry. For those few years that Dr. Masters was a consultant with us, he would come to our clinic. He would do educational lectures to us. He would bring couples in the office, and at the time it was closed circuit TV. We'd be in the other room. He would be doing couples therapy, sex therapy, and then he'd come over and walk over to the room with us, and he'd tell us everything that he just did and why he did it. We got to ask him questions in vivo. So I got involved at a time when sex therapy is a little more popular than it is today. And I was with these pioneers, very credentialed, established people in the industry. And then all of a sudden, because I was affiliated with this group of men and women and people doing all of this incredible work around hormones and hormone replacement, and it's sort of like I became somewhat of a quasi-expert. I was getting invitations to do all these lectures.
Yeah.
And then I got an invitation to start a program for adolescents and healthy sexuality and sexual disorders. So started working with adolescents, and just one thing sort of led to the next. And I had to present my master's thesis in graduate school. And I, was asked to present that in the sex therapy course.
Yeah.
So I felt like kind of like, wow, I can't believe I'm being asked to do this. So I presented it. And when that professor got ready to retire, he asked me to come and speak at his class once a year to talk about my thesis and what I had done, the work that I was doing. And he retired about 3 years after I graduated. And he made a recommendation to the dean that I take over his sex therapy course. So in 1998, I started teaching sex therapy to graduate students, and I've taught it every year, to them. And then in 2000, I started teaching sex therapy to PGY3 psychiatry residents. So I've been fortunate to learn to deploy and work with individuals, see rapid success, and spread that through education.
Yeah. My next question is about training and certifications and things. And you and I were chatting before we did this, and I mentioned CSAT, and you're like, well, that's just one little piece, right?
Sure.
And I know a lot of incredible CSAT therapists, and so I want to kind of flesh that out a little bit more, because I think I'm probably not alone in not really knowing what it means to be a
Sure.
sex therapist, and how do you become one, and
Sure.
trainings. And
Yeah. So to clarify what CSAT is, that's a certification for sex addiction therapists.
got it. Mm-hmm.
And so again, that's one arm of
Mm-hmm.
doing sex therapy.
Mm-hmm.
So if someone has compulsive sexual behavior, addictive sexual behavior, then that's the type of training that would satisfy working with that particular individual, a group of individuals, and that would help prepare a clinician in addition to all of their traditional training and licensing that goes along with practicing in all the different states. There are a couple of other real specific organizations that focus on specifically sex therapy in a sense of looking at desire issues, looking at arousal issues, looking at couples issues, looking at orgasmic issues. And the most, the one in the U.S. that's the most popular is called the ASECT. It's ASSECT.
Okay.
ASECT. So it's American Association for the Treatment of Sex Educators, Counselors, and Therapists.
That's a mouthful.
It's ASECT.
Yeah.
They've been around quite a bit. And so what are the requirements for being a sex therapist? That you first have to have a master's degree and a license.
Mm-hmm.
So that's the very first thing. You have to be credentialed by your state first. And then the process involves getting real specific education on issues around human sexuality and sexual functioning and therapeutic interventions. There are a number of conferences that are done each year. There's something called Quad-S, the Society for the Study of Sexuality, and so that is done annually. ASECT has a conference annually, so you can get some of the requirements for the education through some of these. And then there are a number of universities that have some of this specialty training. So you have to do a certain amount of education. Then you have to do a certain amount of supervision. You have to go through supervision, which can be like 90 hours of supervision.
Wow.
And then, you have to sit for tests and take the test and pass them. pass the test. So it's just like any credential. It requires a pretty significant effort on the clinician. And all of this comes with a very strict code of ethics, because historically, some sex therapists in like the 70s and the 60s were really not practicing like credentialed sex therapy. It was really inappropriate. It gave sex therapy a really bad name by some of the tactics and techniques that were being utilized. And they were abusive to patients, quite honestly. And so some of these organizations were put into place because of some of that unprofessional behavior.
Yeah. Thank you for that. That's helpful information. My next question is about barriers. And initially I was thinking barriers for people to come in to seek treatment, which we've already kind of touched on. But after listening to you now, I'm wondering about what have you run into in teaching other clinicians about sex therapy, like barriers for the clinicians, things that people have had to overcome or work on in order to be able to do this work? Because it is different, and there's like we said, it's kind of loaded, and like any form of therapy, we all, if we're a trauma person, we have to be mindful of our own trauma stuff, and I'm sure if we want to go into sex therapy, we have to be mindful about our own biases and beliefs and ideas about sex. Have you run into problems with students and barriers that they've had to overcome?
Yeah, I think it's you're answering your own question was pretty good, actually. That to be a mental health professional, to be someone who assists people with recovery, to be someone in this field and in this industry requires a tremendous amount of self-awareness and a tremendous amount of openness to understanding the ways in which we interact with each other and the ways in which we can interact with our clients and the people that we're trying to help and assist. When you really move into more sensitive areas of human sexuality and sexual expression, even though we like to think we're an open society about all these topics, we still have a lot of hang-ups. And individuals, even in the mental health field, may not be that interested in examining some of this.
Yeah.
And they may have just unconscious reservations about this. They may have unresolved, models, role models that they've had in their past. One of the things that I have my newest clinicians, newest students, newest people that I'm trying to educate on this to understand are what Gagnon talked about in the 80s called sexual scripts. And it's what you talked about, the idea of we all have to know our cultural scripts. We all have to know our interpersonal scripts. This self-awareness has to go at a very deep level. So when you look at the context of sexuality, we have to be able to answer, and new clinicians and barriers for clinicians, they have to be able to answer, who do they think are sexual? Who do they think will come to see them for sex therapy? And 9 times out of 10, that is a very focused answer that needs to be expanded tremendously.
Yeah.
Because we don't like to think that our aging population needs sex therapy. Because who wants to think about their parents being sexual? There's classic studies where in the 70s, like how often did your parents have sex? Ooh, well, that might be like once every 2 months or something. And then the reality is like, oh, when you ask the parents, they're like, oh, we're twice a week hanging from the chandeliers and stuff, you know? So, who? And then what is considered sexual? We all, as a sex therapist, you have to answer that. You have to have a clear understanding of your gross biases of what you consider sexual. And that has to be expanded. Like, some people may not think talking sensual or sexual to another person is sexual. Propositioning someone is sexual. And so you have to have like a clear understanding of the script of, who, what, where are people sexual? We all have a script where we have in our mind right now, we could pause and think, where am I sexual? Where is it okay for people to be sexual? Where is it not okay for people to be sexual? Well, we have to have this answered in a very deep way. So some of the barriers are actually like having clarity on this and being open to being able to answer that. So that's some of the barriers for the clinician. The barriers for the individuals are just the fear factor, not wanting to sort of share with another person, the secrecy, the embarrassment, not knowing what to ask, not really knowing how simple it can be, how simple, just asking permission can be, how simple, someone being afraid to ask a question because, hey, I'm an adult, I'm supposed to know all about the birds and the bees or whatever the definitions are about human functioning.
Right.
And, the fact that, exhaustion plays a major part, role in sexual functioning. How, believe it or not, one of my first interventions for sex therapy with people is to go walk around the block. The more exercise you have, the more blood flow you have, the higher the probability you're going to have satisfaction through sexual expression. So people are afraid because they wonder, like, what is this really going to mean? What is it? What is really sex therapy? Yeah, it's going to be intrusive. It's going to be intimate. It's going to be asking real personal questions. It's going to be, maybe challenging people to say, is this really what I want? Am I using sex for a non-sexual function? Is this really the relationship I want to be in? Do I really want to be alone when I'm expressing my sexuality? Do I really want to be using technology? Do I really, want to have an artificial relationship? Some people may be more open or not to sort of challenging themselves.
Yeah. So there's this sex positive movement, which I think is great. And that brings up questions for me around navigating this area without these, or being aware of our own biases, as you were talking about. And how do we determine when something is pathological in the sexual realm versus preference? And I have some ideas about an answer to that, but I'm interested to hear from you because there's a lot. People have a lot of different preferences and sexual expressions and things they're into.
Yeah. The main definition of an individual experiencing some type of sexual disorder is it causing distress? Distress in the individual functioning? Is it causing distress in the relationship with others? Is it causing distress financially? Is it causing distress in the vocational world? Is it creating a barrier for someone? And that's mainly going to be defined by the individual or those who are in close proximity and in close relationships. So that's the litmus test. Of course, people will have, all of these different experiences. And, as a sex therapist, I sort of have my own preferences, but that's not really my role to judge someone's preferences when they're in my office.
Right.
And most people aren't going to come to my office unless they're really having distress.
Right.
So I think, encouraging and understanding the sex positive experience, but also there are some behaviors that are just flat out illegal.
Yeah, right.
That are damaging and hurtful to other individuals or are offensive to society.
Mm-hmm.
And we have societal norms just around our own boundaries and the things that we're entitled to. So, I think in most places, public sex is against the law.
Mm-hmm.
And yet we see lots of public sex,
Mm-hmm.
And it's, but at the same time, this is sort of this tension moment of, is this really allowing people to be positive and sex positive versus where is the nuisance value for society?
Yeah, that's right. And so that litmus test is sort of like the same one for most psychopathology, right? We don't want to pathologize things unless there's distress from the person, from other people, the family. And absolutely, because not all the time, obviously, but a lot of the time, sex and sexual behavior involves more than one person. And so the other person is to be taken into account.
Sure.
Another question kind of related to this is sex work.
Mm-hmm.
That's another area where the sex positive movement has really kind of come into play.
Yeah.
And I think historically there's been kind of just an instant judgment about sex work. And now we're sort of looking at that differently and understanding there's tons of factors that can go into sex work, socioeconomic, cultural, and even choice.
Mm-hmm.
And so I kind of wanted to open that up.
Sure.
What do you think?
Well, when sex therapy first started, even Dr. Masters of Virginia Johnson had what they call sex surrogates. And, all of their books had an element of controversy in them. And then their later books had some real controversy in them as it relates to homosexuality. But it's judged a lot of times today on today's values and understanding versus back then when the book was released. But at the same time, we have to recognize that as things change and people change and understandings change, it's what our society is accepting. And it's what individuals are experiencing, that they feel a sense of acceptance, and what groups have come about. You can always find a group that will validate you. Mm-hmm. And I would think, I've heard some things, and then I would see that there's actually a group that this is not so atypical.
Especially with the internet.
Yeah, exactly. So, again, going back to those things that are the individuals feeling a sense that this is a rewarding? Is this something that's freeing? Is this a way that I feel is part of my expression? And is this part of the context of the relationships or the solitary behavior that I choose to express myself in? Mm-hmm. So really, the worker part of it becomes what is being fulfilled for that individual, and respecting that. Mm-hmm. And at the same time, that person may walk through the door and say, I'm not feeling fulfilled. Mm-hmm. I'm questioning this. Mm-hmm. And is that any different than someone in a relationship that shows up in my office and says, I'm in these serial monogamous relationships and I'm dissatisfied. Mm-hmm. So it's really, so it's the person, that's really seeking out, or the couple or the group or whatever we say related to the distress being caused and experienced.
Yeah. There's also in sex work too the element of potential danger.
Sure.
And that's something I was thinking about that as you were talking. It's complicated.
Sure.
Yeah.
I don't like to think of this, but the true expression of sexuality is actually a rather vulnerable act.
Yeah.
And if you really get down to the purity of it, orgasm, you actually lose control of your body momentarily. Mm-hmm. And so how do you reconcile that in your mind? Are you comfortable losing control? Are you comfortable losing control in the presence of others? How comfortable are you losing control in public on a stage in front of a lot of people, being videoed,
right,
on the internet, whatever. And, that I think is a point that I've seen a lot over my career, that just thinking about that vulnerability moment for people and sort of subtly being able to explore that experience with people and letting them come to some understanding of that. So, and even people having anonymous sex can be considered dangerous.
Yeah, right.
Yeah. Of what could potentially happen.
Yeah, right. Thank you.
Hopefully this conversation can take the mystery out of what is sex therapy and how it's the principles are very simple, and yet it can be complex, but yet ultimately the answers and the understandings can be very quick and short term, and the solutions are very focused.
So thank you again, Dr. Hemphill, for being here. This was really interesting for me as a clinician, as a human, and hopefully interesting for our listeners. My goal for this, it is to help spread some more information. It is to help demystify and normalize sex and sexuality and potential dysfunctions, potential problems in that area. And so for takeaways, I'm hopeful that this conversation can help people feel a little bit more comfortable and have some more information around this topic, and that it doesn't have to be that there's a major crisis or a major significant pathology happening. It could just be questions, a desire to maybe explore an area that people don't feel quite comfortable, and you want to talk to someone who has knowledge in this area, a safe person. So those are some of the takeaways from this episode, and hopefully it's been helpful.
Thanks for inviting me.
Thanks so much for listening to Therapy Unboxed with me, Lana Seiler. If you have any questions, please don't hesitate to email us at pod@apnlodge.com. That's pod@apnlodge.com. You can also check us out on the website to get more information, apn.com/podcasts. Please tune in for more episodes. They'll be released weekly. And subscribe, share, drop us a note. Thanks again for listening.